Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Thank you for the chance that given to me. Before I present my research, I want to introduce myself. My name is Isma Yuniar from the Bachelor of Nursing program, Muhammadiyah Gombong University. And my partners are Aswin Wahyono and Mr. Heru Purnomo. Now I want to present my research about the relationship of environmental condition with the incident of tuberculosis patient at Healthcare Center Banjarmangutu, Banjarnegara Work Area. The background of my research are the data from the WHO. The World Health Organization or WHO declares about tuberculosis TB as a very important and serious public health problem throughout the world. And it is a disease that causes a global emergency. Because in most countries in the world, pulmonary TB disease is uncontrolled. This is caused by the number of patients who are not successfully cured, as well as the main cause of the death caused by infectious disease. The one of the cause of the TB disease is the environmental factors. Environmental health includes all physical, chemical, and biological factors from outside the body from environmental health that has the potential to have a health effect. Home environmental factors, for example, ventilation area, occupancy density, lighting intensity, floor type, house humidity and temperature that become the rise of pulmonary tuberculosis. The data from the research site, the Banjarmangutu Health Center Care, the TB case were reported until December 2018. As many as 22 cases, 14 cases were male patients and the other 7 female patients. The 22 cases of the tuberculosis, 8 patients were patients with TB-AFB negative, X-ray positive, and 13 patients were patient tuberculosis AFB positive, and 1 patient is tuberculosis extra lung mammee dextra, result from pap smear. The other phenomena from field observation made by health workers from the Banjarmangutu found that the condition of the house of the majority of people in Banjarmangu live in area adjacent to plantation, resulting in a lack of lighting in the house against direct sunlight. So, from the background of this research, the purpose of this research is knowing the relationship between home environmental factors, include house building materials, lighting, and residential density on the incidence of tuberculosis. The method. We use the method use a correlation analytic research method with a case and control approach. The case sample in this study were all patients with pulmonary tuberculosis who were received treatment for both BTA positive and BTA negative in the Banjarmangutu Public Health. The totaling the case sample is 18 respondents. And the control sample in this study were respondents who were not patients with pulmonary tuberculosis in the Banjarmangutu Healthcare Work Area in 2018, the totaling 18 respondents. Main finding. The first result in my research Result in my research is there is no significant relationship between house building materials and the incidence of pulmonary tuberculosis. This result, according to the Wild research, uh, material house building shows no relationship between types of wall of the house with the incidence of pulmonary. Wall type not effect on the incidence of pulmonary tuberculosis in the work area Puskesmas below. And the number two, there is a significant relationship between home lighting and the incidence of pulmonary tuberculosis. Germ exposed to direct ultraviolet light will die within a few minutes. However, germs can live for up to a week if they live in plegum that is between 30 until 37 degrees Celsius. In the dark, damp, and cold condition, TB germs can survive for days or even months. And the last result is there is no significant relationship between the density of housing and the incidence of pulmonary tuberculosis. This result of the study indicate that the majority of respondents have a dense occupancy that meets the requirement, but this is not in line with the research conducted by Melia Farika Indah in 2014, which state that there was a significant relation between the density of housing and the incidence of pulmonary tuberculosis. So, from the result implication, this research is as a material for developing community nurse program in screening people at risk for TB disease, so that the tuberculosis control process can be maximized. I think it's enough. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.